talk on how to diagnose and treat stress disorders. The psychologist is already here. So just zoom up your belt and remember that you can always call us on 02737-1619. If I were you, but I'm not you, use this time to call in and really ask the psychologist what some of the things that are bothering you. Okay. Thank you, Larry. Thank you. Now, as an introduction, panic disorder is a serious condition that strikes without reason or warning. Symptoms include sudden attacks of fear and nervousness, as well as physical symptoms such as sweating and a racing heartbeat. Post-traumatic stress disorder, otherwise known as PTSD, on the other hand, is a strong and lasting emotional reaction to a very disturbing event, such as war, violent, crime, or natural disaster. These events make victims feel scared, confused, or angry for a while. Symptoms include having nightmares or flashbacks about the event and not being able to feel or express emotions towards loved ones, and being easily angered or on edge. So in this broadcast, we will be looking at the cause, diagnosis, and treatment of stress disorders. Among the disorders we'll be looking at are the panic disorder and post-traumatic stress disorders. So, help me this hour receive the only one that is going to analyze this problem and at the same time give us some psychological insight to some of these problems and also answer. Help me, Radio Voice of Naija, receive our own Mr. Roderick Baker. Welcome to Radio Voice of Naija.
Thank you very much. I'm very happy you have me here.
Yes, we are happy to have you too. So, Roderick, please, would you, let's start with panic disorder. Right. What is panic disorder and what causes it?
Well, a panic disorder is actually a common anxiety disorder. Within our practice, we have in Zuidoost, it's called Cohen-psychologen. I've been here before. It's quite common. I've treated many people with this disorder. People who encounter this panic disorder, they have sudden and repeated attacks of fear that last for several minutes. Sometimes it can even take longer. These panic attacks are categorized by different kinds of fear. Some people, they are afraid that they are going to lose control. Some people, they are afraid they're going to faint. They're scared of fainting. And others are afraid of getting a heart attack. And these strong physical feelings that they are feeling are being wrongly interpreted by them. For example, people who faint, actually their heartbeat and their blood pressure, it will decrease, while having a heart attack, it will actually increase the heartbeat, and also the blood pressure will increase. So it's being wrongly interpreted by these people, but it does cause these people to think that they are failing. It's not really clear what causes panic attacks. It often occurs after, for example, a significant life event, like if you lose your job, if you lose a relationship, or something big happens in your life, it could result in panic attacks. But it's not really clear how they, what causes them. I have some patients, for example, who, let's say, they go to a restaurant and they're ordering food and they're not feeling so well and they faint because maybe they didn't eat well that day, or for example. But let's say, yes, sometimes people faint in life when, let's say, if you don't eat enough, if you don't drink enough, it could cause that you're going to faint. But let's say the week after this person goes again to the restaurant, and actually he ate well, everything is okay, but he remembers this time that he was fainting, or she was fainting, and this could cause stress within him. He's like, oh, okay, I feel now a bit dizzy, I might faint again, and they increase, the stress symptoms will increase, because they remember last time I fainted. They're not going to faint at that moment because they ate well and everything, but it's stored somewhere, and the feelings when you, I don't know if you ever fainted in your life, you feel a bit dizzy, you feel a bit sweaty, or etc. But it's not the same.
So is a panic disorder the same as anxiety disorder?
Yes, I mean, people use different terminology. An anxiety, it's not the same. An anxiety disorder is actually a panic disorder is among anxiety disorders. There are many anxiety disorders, like social phobia is an anxiety disorder.
Yes,
specific phobia is an anxiety disorder. But also, we're going to talk later about the PTSD, the post-traumatic stress disorder. That's also an anxiety disorder. So panic disorder is among the anxiety is the broader spectrum. Yes, exactly. So there's also the generalized anxiety disorder. These are people who are afraid of many things.
So, from your practice, what do you think are the symptoms of this disorder?
Well, what people told me, and what is in our what we diagnose, the symptoms people encounter are the pounding heart. I already said that. The sweating, breathing problems. Some people encounter dizziness. They feel numb hands, chest pain, stomach pain, feelings of hot or cold chill.
Feeling of what?
Hot and cold chill, or cold. It can be, you can feel really hot suddenly, or a bit of a cold chill. It can be a symptom of this. And you have the feeling of losing control, and the fear of dying, fear of fainting. And it's like 4 or 5 of these symptoms that occur at the same time. And in some cases, people, when they start feeling these symptoms, they are trying to avoid that. So some people have, which is called agoraphobia, which means that people are avoiding to, let's say, use public transport.
Yeah.
Because they are scared when they are in the bus and the bus is leaving and the doors are closed, that they're going to feel this anxiety, and in their mind they think they're going to faint, which in general is not. They think, you know what, I'm not going to take that bus anymore, because when I'm in the bus I can't go out and I panic. It's the same with people who don't use elevators, for example. They say, I don't want to be in the elevator because I feel anxious, I want to get out. But the problem is that this is generalizing. So it starts with the bus, then it's the tram, then it's the metro, then it's the train, then it's the airplane, then it's, for example, the concert. Yeah, like you were saying, like you have some nice meetings with a lot of people, you do for television shows, but these people will also avoid these things because they are scared that, well, let's say there's a concert, someone, like this nice gospel singer you just broadcasted. Let's say you go to a concert of this man, and these people think, yeah, but what if I go to the concert and I get this panic attack? I don't know where to go. Can I find the exit? I don't want to go. So they start avoiding, and they are suffering, because it could even go as far. I have patients who are, some are young or old people lose their job because they say, I don't want to go to work anymore.
It's terrible.
Yes, it's terrible. And they stay at home and they say, you know what, I'm not going out anymore. They lose social contacts.
Yes.
And eventually they get depressed because they stay at home, and there is, I mean, it has a big impact on life.
But how did the fear come about? Why would they be afraid of fainting or afraid of dying? Where did the fear come about?
It's really difficult, because sometimes we don't know. Sometimes it's really clear. Let's say if somebody had a moment where something happened to him, like I said, somebody fainted somewhere in life, but every time when they feel a feeling which is close to this fainting, they will think, oh, I'm gonna faint, which is actually not, but they will think they're gonna faint. And what they do in this moment is, I leave the situation, I go out of the bus, I go out of the metro, I need some fresh air, I cannot go there anymore. And that's, they start avoiding things because they think, I don't want to get it there, I don't want to get it there. But it even occurs that people have it in their sleep. While they're sleeping, they have panic attacks. It can generalize a lot. So we don't know for sure sometimes how it started. It can also be that people had a really troubled youth. Let's say you had a lot of abuse in your youth, or a lot of anxiety. And it can occur after years. Sometimes we just don't know why it occurs, but suddenly it starts. People have these feelings. What I try to explain to them in therapy is that although these symptoms, they have a really big impact on their lives. I'm not saying that, but physically it causes no harm. It causes no harm to them. In their interpretation, they think, oh, I'm going to have a heart attack, or something bad is going to happen to me. In real life, it's not. It's not. Although it feels. I'm not saying it's gonna. I'm not telling my patients, don't worry, it's nothing. No. For these people, it's really, really bad feeling. But with treatment, with help, they can really. I'm trying to give them exposure to this feeling. So let's say you have a panic attack and you go in the bus. I'll tell my patients, stay in the bus. I know you feel bad, but stay in the bus. To prove to yourself that this anxiety, in the end, if you stay in this bus, it will decrease. Because when you feel this, and you go out of the bus, you'll tell your body, I cannot handle this. I have to get out of the bus. So you teach your body that the anxiety won't decrease, only if you get off the bus. But if you stay with these feelings of anxiety in the bus, and you'll see after a few minutes, because the anxiety level won't be as high constant, it will decrease after a while. You can teach yourself, oh, okay, when I go in the bus, I get this panic attack, which is really bad, but I can handle it, because if I stay for 10 minutes in the bus, it will decrease. So it's really important for my patients I'll try to expose them to this. Sometimes I join them in the metro in the beginning, if it's really, if they are afraid to go.
So can it be considered as a mental problem?
As a what, sorry?
A mental problem.
It is a mental problem, yes, but it causes physical reactions. I mean, if you are, let's say, I don't know, are you afraid of spiders? When you see a spider, you get a physical reaction. When I see the spider, or maybe your husband sees the spider, maybe he doesn't get a physical reaction. Can we say it's mental? Yes, I think so. It doesn't mean that you can control it at that moment. I could also say to you, stay with the spider in a room for half an hour, and you'll see that your anxiety level it will decrease after a while. But in general, people either kill the spider or run away from the spider, so they don't prove themselves they can handle it. I'm not saying spiders are nice creatures.
Yes, of course. I don't like seeing spiders or seeing all of those little bitches. I don't like seeing them. Yes, Christian.
So why are women easily scared by insects or snake or snake is
snake?
No, that's serious, but like an insect or cockroach or something. Why are women easily scared by that man?
Well, I must be honest. I'm not sure if women are more scared than men in general for spiders and snakes. I think if you see it to survive, it's quite smart of us to be scared of snakes because they might kill us. So I think if I see a snake, I will also be scared, and I think your wife will also be scared. But I think that it's people also learn this. Like, let's say your mom says, you shouldn't be scared of spiders, you shouldn't be scared of spiders, and your father says, no, I'm not scared of spiders. Maybe this is also how it works. I think in the basic sense, we are all scared, and it's good for us.
Of something.
It's good for us to be scared of snakes, to be scared of a tiger, because they can kill us.
Yeah.
But I think if there's a small spider that cannot bite you, and you say, okay, I'm gonna move now because I don't want to live in this house anymore because there's this itchy small spider. I think, okay, then we need to examine this and to see if we can change this cognition that this small spider can do something bad.
Okay, so the situation we are handling today is not just about this little panicking over little things like spider, but it is like a condition that comes, and it comes and it remains for a while. It becomes like a sickness, is that?
No, well, I think in Holland, I did my research, and around 15–20% of people in Holland encounter a panic attack in their lives. It doesn't mean they have a panic disorder. A panic disorder, it starts when, let's say, you had a panic attack, and you're constantly thinking, okay, I'm going to have another one. I'm scared of having this again. I'm going to start avoiding places. I don't want to feel this anymore. When this is constantly in your brain, then it's forming into a panic disorder. I mean, it could be that someone has a panic attack. Let's say they lose their job. Suddenly they come to the work and the boss says, you know what, today you're fired. You cannot stay anymore. And this person feels a lot of stress. He thinks, oh, I'm going to lose my job. How I'm going to put the food on the table, etc. And this man has a panic attack. But after this panic attack, he goes home and he relaxes a bit and he thinks, you know what, I'm going to try to find another job. And he doesn't think of this panic disorder, panic attack anymore. But some people don't react like this. This differs. It has to do with temperament. How are you as a person? It has to be with neurological levels in the brain. How do you react to stress? Some people will remember this event and say, I don't want this anymore. Oh no, I'm going to stay at home. What if I get another one? So it differs per person. Some people react differently.
Let's put this into practice now. Let's be a little bit real, okay? Like the incident with the guy that just crashed the aircraft and they killed 156 people. Can we assume that he had panic attack?
I don't think so. I don't think he had a panic attack. I think in this case, I read about it.
Because you said when panic attack comes, the people want to just exit from.
Yes.
All right. So let's assume he was hanging there when the other pilot left. And then probably the attack came, and then he began to see double. Maybe he began to feel that he has to calm down. You know?
Yeah, but he doesn't. Like, if you have a panic attack, you don't want to exit life. You want to exit the situation. So to exit the situation, in this case of the pilot, would be to get the other pilot and say, you do it, I don't want it anymore, I don't feel well, I want to be in the back of the plane and sit there and, I don't know, avoid flying the plane. Because it doesn't mean when you get a panic attack, if you're on the bus, that you want to jump out of the bus and kill yourself. That's not what you feel. I think with this man, and this is speculating, I read about a famous professor in Holland. He used to teach me at the Vrije Universiteit when I was a student. And he said about this man that probably he had suicidal thoughts for a long time. And that he didn't think of all these people who were in the plane. He was just thinking about himself. And he was thinking that he was, actually I thought it sounds like a hypothesis, like a plausible hypothesis to me, that he said that if you are, let's say, a police officer and you want to commit suicide, you use your gun. When you are a pilot and you want to commit suicide, you use your airplane. That's what he said. And they don't think of
other people.
All the other people.
Exactly.
He thinks about himself.
At that particular moment, it's about him.
It could be. I'm not sure. We don't know. Maybe he planned this all before. We don't know yet. I think it still has to be. But the hypothesis that this professor said, could be. This could be it. That he was not thinking of all the planes, just about himself. He wanted to commit suicide. On the other hand, there was a German psychotherapist who said the complete opposite. He said, no, this man has been planning this for years maybe, and maybe he wanted to feel, to let the people who are left behind, like the victims who died, their family members who are going to grieve a lot, maybe he wanted to make them feel like how he felt because he was depressed. This is another hypothesis. I don't know which one we'll see. I mean, the investigation has to show, and I mean, I heard he was in therapy, he was depressed before, he was taken into a hospital, he had a psychiatrist. In these files, probably we can find the truth about the situation, exactly. But we have to wait for this, and I'm not sure if this ever will come out, because this is also with medical files, it's not so easy to get them open to the public. Maybe, I don't know.
Okay, so then what do we qualify his situation? Because if it is not panic disorder, it's not panic attack, then what would his situation be?
I think it's more towards depression.
Depression.
Yes, that he was
All
depressed.
Right, you made mention that when people are having panic disorder, and it continues, they keep they keep excluding themselves.
Yes.
All right, it could lead to depression.
Yes, for sure.
That's what you said.
Yeah, because if you, let's say you have panic attacks, and let's say you have a normal life, you have a job, you have children, you have a nice family, you go to church every week, and you get these panic attacks, and it starts with you're saying, okay, I'm not going with the bus anymore, I'm not using public transport anymore, I'm going to use my bike. After a while you're saying, you know what, I'm not going to church anymore, because every time when I'm in church, I'm scared of getting this panic attack. I'm not going to work anymore, etc., etc. These people isolate themselves.
Yes.
And when you isolate yourself, and you're at home, I mean, let's say if you're now at home for a week, you wouldn't go out, you wouldn't talk to anyone.
It's terrible.
It's terrible. You're going to get depressed. I mean, yeah, that's...
Exactly. So, may I ask, this syndrome, is it peculiar, or this sickness, is it peculiar with some ethnic tribes?
Well,
because I don't think I've ever seen people from from Africa, right? I haven't seen many of them who are having this panic attack and panic. But here, I've come in contact with so many who are having panic. You know, I go about wondering why.
Well, I think probably what I think is that it exists. I mean, I had patients here in Holland from African backgrounds with panic attacks, but they don't call it panic attacks. They, for example, call it, they say they are, some said, I'm possessed. Because they don't know what's going on. They don't know. They have these certain feelings. I mean, also in Holland, when people have panic attacks, these symptoms, they don't know what's going on. They might think I'm getting a heart attack or I'm having physical problems, and then they go to the general practitioner, and the general practitioner might say, you know what, I'm going to send you to the psychologist, because first they do, of course, research to make sure it's not the heart or it's not something, and if it's not that, if that's not the case, then they might send them to a psychologist. But yeah, with different cultures, it's different ways of expressing. They don't know the word panic disorder. Depression is, for example, a really common word in the Western society, but it doesn't mean in Africa or in Asia that they know the word depression. It's our word, we created it, but in different cultures it has different names or different...
So when they come to you, they say, we are possessed, you said?
Some people said to me, I
possessed with what? With fear?
I don't know, possessed, or people from Suriname said I'm possessed by a demon or something is inside me, because they couldn't explain what is going on. And I mean, I have my perspective, and I work with their perspective. I'm not saying it can be a demon. If you think it's a demon, it could be. But I'm trying to treat you.
Yeah.
And that's how I work with people. But they have different names.
So that means even when they come and they say they feel they have demon inside, then you understand it from psychological point of view that it's depression, is that?
Sometimes I think, but this is my perception, I mean, I'm raised in a Western society, I've been schooled in a Western society, doesn't mean what I'm saying is the truth, but I'm trying to help them.
Yes.
I had, for example, many patients from Suriname with depression, and I was treating them for a depression, but on the same side they used the spiritual doctor to, let's say, give them...
spiritual doctor?
Yeah, like...
Which doctor?
I'm not saying which doctor, I think that it's more within the culture that they do certain rituals,
traditional
to wash them in a special way, or etc.
Yeah.
To sometimes
drive away the demon.
Exactly. And that's what they explained to me. And for me,
You don't
if I
see
look
it.
from my perspective,
Yeah.
I might think, oh, okay, I treat depression, but it's this person's culture. I cannot say this is not true.
Yeah.
I don't know. So I let them treat it their way, and I treat my way, and I try to make that one thing, not to exclude it. I'm not gonna say this is not true. I'm not familiar with it, and sometimes I think. Sometimes I feel bad for patients because they have to pay a lot of money for some of these rituals, and then I think, oh, I wish they would just stay here, but it's my feeling at that moment. But
All right, yes.
Do you have, let's say, Christian psychologists in your practice? People who are, Christians, let's say Pentecostal Christians?
There are enough psychologists who are Christians, but you also have special institutions in Holland which are really Christian based, and they're specialized in using religion and psychology, and they're better than me. Sometimes if somebody's really religious and he tells me I want a specific
treatment
psychologist, then I can refer them to a special.
No, because when you were making the comparison between those from, let's say, other cultural backgrounds and those from the Western background, and somebody says I'm possessed, and then you don't see it that way. You see it differently from your perspective.
Yes.
Yeah. So, but I'm wondering, so how a Christian psychologist will see a situation like that? I think that Christian psychologist might see it differently, or perhaps see it in line with what, let's say, the other person sees, who thinks he or she is possessed.
Yeah.
Because in the Christian worldview, we do recognize, the workings of, let's say, evil spirits, for example, in people's lives. As a minister myself, I've seen this thing. So, of course, we appreciate the work of a psychologist, but this other dimension of it, the spiritual dimension of it, they don't quite see. So I'm glad you raised that, and that's why I wanted to know whether you know Christian psychologists and how they will interpret a situation like what we're talking about.
Well, I can give you an honest answer. When I have, let's say, a patient from Nigeria or from Ghana, first of all, I try to include the church, the minister, the pastor, whoever is there, because they can take this part. They know better. I want to know. Tell me about it. And the thing is, and might sound a bit cruel, but sometimes I don't care what is the cause. There is a cause. Sometimes people come to me with pain, and the doctor says, I don't know what it is. The hospital says, I don't know what it is. Then I say to this patient, okay, it's really bad for you that they don't know, but I want to try to improve the quality of your life. And what causes it, if it's a demon, if it is a depression, if it is a panic disorder, sometimes I don't mind so much. I'm trying to see how can we raise the quality of life.
Yes.
And yes, a pastor sometimes can give really good insights about how a patient from Ghana feels. And I listen to this, and I try to implement, and I try, when I see a patient who resembles this, I will say, a pastor once told me, or a minister from Ghana once told me, or from Nigeria, and my people also educate me, the people that I treat here, my patients from Ghana, from Suriname, from Morocco, from Turkey. I listen to them and I work with their culture. I cannot say, oh, I'm Dutch, this is my culture, this is yours. I don't believe in it.
Yeah.
It doesn't work like that.
No,
For
no,
me,
no.
I mean, I don't think it works like that.
Well, thank you so much, Mr. Roderick. And somebody out there listening, this is coming to you live on Radio Voice of Naija. And our topic this wonderful morning is on how to diagnose and treat stress-related matters like this anxiety disorder and panic disorder. So feel free to give us a call on the studio line on 020-737-1619. I think this is the right time for you to really call and ask questions to the psychologist who is live in the studio. Probably he may have something to tell you that may ease your situation. Don't talk in yourself, hide your problems, and then feel as if there's no solution. There is a solution.
Yeah.
So that's why we are bringing the best of the people to come and talk to you. So make use of this opportunity by calling in and asking that which is necessary for your own situation. Thank you. All right, Roderick,
yeah.
please, how common is this panic disorder? How common is it?
Well, the diagnose itself, like in Holland, it could be diagnosed between 3.5% and 4% with people. Like I said before, people in Holland in their lifetime, if they, the amount of people who encounter panic attack in their life is sometimes more than 15-20%, some studies say.
Yeah.
More after it happens more among women, 1.5 to 2 times as often, and also more among people who are divorced or widows. And this can also relate to loss of a partner, so these big life events.
Yes.
With women, I don't know, I can speculate. In the society there is a lot of pressure sometimes on women. They have a job. Nowadays, if I take the example of Holland, they work sometimes, I don't know, 32, 36 hours, and they come at home and have another job with 2 children, 3 children. This brings a lot of tension, and the higher your tension level is, then you can also get more
panic.
Yeah, any anxiety disorder. The more stress you encounter, the more you feel, the higher chances you can get an anxiety disorder, among which is the panic disorder.
Are there any side effects to this disorder?
Well, the side effects are, like I said, start avoiding places, the impact on life, on school, work, etc., etc., etc. Yeah, these are the side effects of this. I think that some of the patients that I treated, if I looked at their quality of life, it was so low, they did so little things, while in therapy, sometimes even after 6, 7, 8 sessions, which means sometimes 6, 7, 8 weeks, they can do so much more. It's really a disorder. I like to treat these patients because you can see, not always, but in general, I think in 70-80% of the cases you can see really quickly results.
Okay.
They go out again, they do stuff again.
Okay.
And it's hard work, the therapy. I'm not going to say it's easy.
Okay.
It's hard work, but the results, they come quickly, and I think it's really nice to see. I had a patient just recently who was afraid of flying, actually not only flying, also buses, trams, metros, and her grandma got sick, and I think she's dying, and she wanted to see her. So I started treating her for the flight anxiety. She was actually afraid to get a panic attack in the airplane.
Yes.
And eventually, after I think I saw her for 3 months, she was ready, and she went to visit her grandma. She came back, and she was so happy. Well, she didn't fly for, I don't know, 5, 6 years. She didn't see anyone of her family, and she saw them again. And I was really happy for her.
Yes.
And she was also surprised. She didn't believe that this would happen at the first session. When she came in, she thought, this is a problem, this is never going to change, I'm going to suffer. And after 7, 8 sessions, she was, okay, I see, I believe in it, I can do it.
Are there some people you've treated and that the problem reoccurs?
It can reoccur, but the thing is, if they had therapy and it reoccurs and they come back to me, sometimes they only need 2 or 3 sessions. I just tell them again, what did we practice, how did we do this, practice this again, then again. They're like, oh, okay, yeah, now I can go again. Okay. So, you know, it's shorter. You don't need, sometimes the first time it could take even 6 months or 1 year, the treatment, but when they come for the second time, it's way shorter because they already have the knowledge, they already been through therapy. So it can shorten the treatment.
Can this disorder become a chronic situation?
A chronic panic disorder?
Yeah.
If you don't treat it, yes. If you have a panic disorder and you don't go to the psychologist, sometimes, in some cases, of course, over time it will go away, it will pass. But if you have a panic attack, some people have it for 10, 20 years before they come to me. They don't know. They think this is part of their life, that this is normal, and they are ashamed to talk about it. A lot of people with mental disorders, they keep it to themselves. They think, I'm not going to tell my family, they're going to think I'm crazy, I'm not going to say anything. And then sometimes they see a television show, or sometimes they listen to a broadcast like this and they think, hey, I know, I have this.
Yeah.
Now I can give it a name. It's a panic disorder. Oh, and I can seek treatment for it. This is amazing.
Yeah.
You know, this is how people get to know this. Or sometimes a physician says this, or sometimes they meet a psychologist and they say this. But these, I think, radio station, television shows about this with good information is very important, because then people will recognize, they can name it, and they know that there is hope and help is there.
Yes. Okay. Before we take a short break.
Well, I think I like the way you put it, because there are conditions in people's lives, many conditions which are some sort of disorders, but probably there's a sort of stigma around this kind of issue. So people, like you said, some people have lived with it for years and they never would mention it until they watch a show or listen to a show, and then they have the boldness. Exactly. Would you mention a couple of instances, from your experience in the practice, which people have and they don't really know that they don't know it's a disorder, but which can be treated in a very simple way, and they can their lives, the quality of their life can get better. Would you just mention a couple of disorders that people probably have, most people have and don't even know, or they don't know how to treat it?
Well, of course, thank you for the question. Yes. First of all, the panic attacks we just talked about, but for example, social phobia, it's also something. Some people are afraid to, let's say, speak in public. At work, when they have a meeting, they freeze, they don't know what to say, they get anxious, and they think, you know what, I'm not going to say anything. I'm not going to start a new education because I'm really scared of that. And they can also seek treatment for that. They can. I'm not saying they're gonna be the best speakers, or they're gonna have a concert in front of 30,000 people. But at a meeting with maybe 10 to 20 people, I can try to. We treat them for this. So this is an example. Other examples are pain problems. Some people have a certain form of pain, let's say in their leg, in their arm, in their shoulder, and they say this is never gonna change, and they suffer a lot. They're avoiding things. They are saying, I'm not going out anymore because the shoulder is hurting me so much. I could also invite them and try to for treatment, and try to say, okay, but what are the consequences of this pain? How can we change this? I mean, your cognition, how you think of this. When you have this problem, let's say a shoulder pain, it doesn't mean you can't have a social life. We can, but there are many things. Also the cases of depression, people who feel depressed, stay at home, isolate themselves, don't have any joy in life, the quality of life is very low. It doesn't mean you can't be treated. You can. And I think to talk with a psychologist about your problems can really help.
That's a very good one. Thank you so much. We're going to take a very short break right now. There's somebody out there who is listening to this broadcast. Remember, it's coming to you live from Radio Voice of Naija, transmitting this hour on 105.2 MHz ether and 103.8 cable. Don't forget, you can always give us a call on 027371619 as we discuss this issue on how to diagnose and treat stress-related issues such as panic disorder and anxiety disorder. Shortly, when we come back from this break, we will be treating on post-traumatic stress disorder, which is PTSD. So stay tuned and don't forget to give us a call. This is Roderick Becker. Roderick, wouldn't it be nice, please, that you tell people how they can meet you? Yes. Because maybe there are some people who are out there and they are wondering and they think, oh, Voice of Naija, please don't just hide this man alone. Let him say something about himself. Come on, go ahead.
Thank you.
Go ahead and tell them.
Thank you for the advertisement. No, we have a practice in, we have actually several locations in Amsterdam Zuidoost where we have a practice. We are in different healthcare centers in Klein Gooihoort, which is on the Belmerdreef. We have a place at Holendrecht, Gezondheidscentrum Holendrecht. We are in Vensterpolder. So we're actually all across Zuidoost.
Wow.
If people want
that means the business is really going very fine. It does not mean that you like people to always have panic attack?
think we have
because when they are very sound and they are very, very sound and healthy, you may not have clients.
no, that's true. No, I think our practice is doing well, and we're in the center, so the doctors are close to us. The patients don't have to travel. I don't know how far to get to the psychologist. We are in the same center as the general practitioner, so I think it's nice for the people.
Did you give your telephone number? That I can do, or they can go to our website and see more of.
Yeah, no, I can give the telephone number. It's 020 416 0069.
Say it again.
020 416 0069.
0069.
And it's Cohen Psychologe.
Hems.
Cohen is...
Cohen Psychologue. Yeah.
That's
yes.
The practice.
Yeah, he came the other time to talk on midlife crisis. But you know, I would really like to repeat that topic.
Okay.
Yeah,
I'll ask him next time to join me to come to the broadcast.
Okay. Now let's go ahead and discuss about PTSD.
Yeah.
Post-traumatic stress disorder. I would like to know why do some people get it and others do not get it?
Well, we aren't so sure of why certain people get PTSD and some are not. It's probably caused by a complex mix of different things. So first of all, it's inherited mental health risks, such as an increased level of anxiety or depression. If you encounter this as a person, it will increases the level of you having post-traumatic stress disorder.
You said it's inherited?
I mean, it's inherited the level of anxiety, or if you get a depression, if you're prone to getting a depression or not.
Yeah.
So let's say if you encounter a traumatic event, could be a robbery or whatever. If you have, let's say in your family runs a lot of mental health disorders, then the chances of you developing a post-traumatic stress disorder are higher because within your family there's a genetic
I've seen a case of somebody who did not have mental disorderliness in their family, and yet the person is having this post-traumatic stress disorder, and it has lasted for a while now.
Well, it's not 100% heritable. There's just a genetic component. It depends. But the chances might be higher. There are other things. I mean, if you, let's say in your youth, if you had a lot of neglect or trauma or whatever, there's also a higher chance of developing this disorder. It's also in the aspects of the personality, in the temperament, let's say. So that also, and it also has, it's difficult to explain, but within the brain, how chemicals and hormones are regulated and how they are released in responses to stress, that's also, this varies from person to person. So sometimes it's difficult to...
Wow.
Yeah.
So how does it affect them emotionally?
The patient?
Yes.
Well, it affects them greatly. They have people with PTSD, they suffer a lot. There are so many different symptoms. They have intrusive memories. It's recurrent memories of a traumatic event. It keeps popping up like flashbacks, and you cannot stop this. So let's say if you had a robbery or you had a sexual abuse, or I don't know, at any given moment this can come up in your mind, and you cannot hold this back. So you keep and you're trying to push it away. These people try to avoid it. They don't want to talk about it. They don't want to feel this. They don't want to think about it. But it keeps coming. It keeps coming.
Yeah.
So in therapy, actually, we're going to give exposure to this. So we expose the people to what they've been through.
Yeah.
And I think in Dutch I say, so the emotion is not that loaded anymore.
Okay.
Because if you keep pushing something away, it's like a ball you try to keep underwater. You can push it for a while, but after a while you cannot hold it underwater and it goes up. And this is what's happening to them. So
really,
that's a question I need to ask before you go.
Yeah.
you spoke about post-traumatic stress disorder, and there's also postnatal depression. How are the two related? Are they different? Or one is about after having given birth? Yeah.
Well, this is a depression. It's also, I mean, I'm not specialized in this area, but it has to also do with hormones changing, and it can cause a depression in females. After you give birth, there are certain hormones you give birth to a baby, and then there's a change, a level change, and this can cause depression, but this you treat as a depression. It can also be that people who are women who are pregnant, that they at birth, when they give birth, it can be also post-traumatic stress disorder created, because some people, let's say they have a complicated delivery, and I don't know, they wake up, their baby is not there, their partner is not there. It can be very frightening to these people, and they can also have flashbacks for this. I treat people also for that.
Thank you so much, Mr. Roderick. But the fact is that next time we would like to know a little bit about how you diagnose those who have sexual trauma, and how you treat them. Because I believe that there are so many who are out there who have sexual trauma, and that this problem is really confronting them every day. So that for the sake of time, we will not dive into that now. So we hope that next time we will go into that.
For sure.
Right. And what last word are you saying to our audience?
Well, I want to say that now that we didn't discuss it yet, but in our practice we treat a lot of women who've been through sexual abuse, and there is also a stigma around this topic, and I think next time I'll go more into depth about this topic, but they're really welcome to come. And it doesn't matter if it's me or another psychologist, but they can be helped, and I think it's really important, and this goes for in general, that you have to feel comfortable around your psychologist. If you come to a psychologist, could be me, and you say, I don't feel comfortable with this man, it doesn't mean psychology doesn't work. I mean, when I also want to feel comfortable around my general practitioner or my dentist, and if I don't like it, I'll choose another one. Also do that with your psychologist. You need to have a bond before, especially with these topics. So that's what I wanted to, and thank you for having me.
Thank you so much for coming, and we hope to have you again and again.
Okay, well,
God richly bless you.
Thank you very much.
Bye-bye.